Good day, my name is Muhammadin Jamalon, a nursing student from Notre Dame of Tacorong College of Nursing. So today I will be performing the assessment of the musculoskeletal system. The first procedure is assess the client's physical and psychological aspect before during examination. Rationale allows the healthcare provider to gather complete data about the client's health status. Good morning, sir. Kamusta po kayo?
Okay lang po.
Okay, thank you. Next is review the body areas to be examined. Rationale helps examiner or the healthcare provider identify which part of the body to be examined. And the next is the make a physical and environmental preparation before examination. Rationale, proper preparation of the environment, client, and equipment ensures smooth physical and examination with the interruptions. Then, the next is the explain the procedure to the patient or the client. Rationale, explaining the procedure uh, to be done and reduce the anxiety. Sir, ngayon po ay i-assess natin ang inyong musculoskeletal. So, okay lang po ba sa inyo?
Opo.
Okay. And the next is properly position the client. Rationale, proper positioning ensures easy access to the body parts to be assessed and client feels comfortable. So, pupo tayo ng maayos, sir, ha? Okay. And the next is take the health history of the client. Rationale, to have a comparison with previous illness and present health condition. Sir, dati po ba nagkaroon kayo ng sakit sa inyong muscles, sa inyong katawan?
Wala po.
Wala naman? Sige, thank you. Next is conduct a physical examination using the four skills in assessment. Rationale to assess, determine, and identify abnormal findings in the body system. And next is the inspect the muscle. Inspect the muscle for size. Compare the muscles on the side of the body to the same muscle of the other side. And for any discrepancies, measures the muscles with a tape. Normal results equal size both side of the body. Next one is the inspect the muscles and tendons for contractions. Normal results, no swelling, no contractures. Next is the inspect the muscles for tendons for the example by having the client hold the arms out in front of the body. Normal result, no tremors. Seven plus. The next is test the muscle strength, compare the right side with the left side. First is sternocleidomastoid. Client turns the head. Client turns the head to one side against the resistance of your hand. Then repeat with other side. For the normal result, equal strength on uh, equal strength on each body side. Okay, dito sa right. Tigasan niyo po sila. The next one is trapezius. Client shrugs the shoulders against the resistance of your hands. Next is the deltoid. Client holds up and resists while you're trying to push it down. Tigasan niyo. Next is the biceps. Client fully extend its arm and tries to flex it while you attempt to hold arm in extensions. Next. The next one is the triceps. Client flexes its arm and then tries to extend it. Try to extend it against your attempt to keep arm in flexion. The next one is wrist and finger muscle. Client spread fingers and resist as you attempt to push the fingers together. Next is grip strength. Client grabs your index and middle fingers while you try to pull the fingers out. Hilain na to. Yung isa. Next is the hip muscles. Client in supine, both legs extended. Then client raises one leg at a time while you attempt to hold it down. Higa po, sir. Baba mo. Higa, sir. The next one is the hip abduction. Client in supine, both legs extended. Then place your arms and legs lateral surface of its knee. Client spreads the legs apart against your resistance. The next one is hip adduction. Client in same position as for hip abduction. Then place your hands between the knees, client, and brings the legs together against your resistance. Okay. The next one is the hamstrings. Client in supine, both knees bent. Then client resist while you attempt to strengthen the legs. Next one is the quadriceps. Client is supine knee, then partially extended. Client resist while you attempt to flex the knee. And the next is muscle of the ankles and feet. Then client resist while you attempt to door flex the foot and against resist while you attempt to flex the foot. And the next one is the inspect and palpate joints for tenderness, smoothness of movement, then swelling, and crepitation and the presence of the nodules. For the normal results, no swelling, tenderness, no nodules. And the next is the reflexes. Um, bicep reflex, the patient elbow is slightly bent forward while your arm is surrounding the patient by arm placing the uh, placing your forearm and diagonally underarm the patient's arm. Then strike the biceps tendon. Strike the bicep tendons with a percussion hammer. Higa po tayo. Bangon po, sir. Upo po tayo. Alis ka muna po. Upo po. Okay. For the normal results, the contraction of the biceps can be seen in felt. The next one is the triceps. A triceps reflex. So the patient's elbow is lifted and bent while you're hanging freely with your hand and supporting the patient's arm by holding the distal humerus. Then strike the triceps tensions and one thumb from the body prominences of the elbow using the percussion hammer. For the normal results, the contraction of the triceps can be seen in as the elbow extends. Yeah. And the next is the knee. The patient is the sitting position, and the patient is struck with the percussion hammer percussion hammer. If patient is lying down, then the reflex tested um, while the examiner's hands are replaced under the knees to bend them. Normal results. The contraction of the quadriceps causes the knee to extend. Huwag mong tiyasin, patutukan ang pagkakita. Patulo. Yung man, patutukan. Okay? Um, the next is the plantar. So, reflex aspect, the lateral aspect of the sole of the foot is struck with an object. Then, stroke the lateral border of the sole of the client's foot. Then, starting foot and the proceeding across the ball of the foot toward the big toe. Then, for the normal results, the toes bent or the curved. Okay, baba, higa ulit tayo. Diyan lang. Higa ka na. Higa ka lang din. Okay. Dapat dito. And the next is the reposition the client to ensure client's comfort. So, upo na po tayo, sir. Bago na po, upo tayo. And for the evaluation, make findings of the health assessment and physical examination done on the client. Rationale, there are important data to these are important data to convey to the physician to aid in the diagnosis of the patients. And for the documentation, record and the document report any pertinent findings and found during the assessment to appropriate personnel. Then for the rationale is to provide accurate data in the care of your client. And as for now, the assessment of the musculoskeletal is complete.